Okay, I'll call the meeting to order. We're working without these mics. We're working with boom mics today. I will call it to order. It was properly posted April 5th. Since all three commissioners are present, the first is moved. Is there a no minutes to approve this time? And is there someone doing a pledge of prayer?
Not to my knowledge, unless Mr. Barnes is aching to do it. Do you oblige us, Mr. Barnes?
Let's pray. Father God, we're thankful for the day that you've given us. We're thankful for the opportunities to serve others, Lord. Just pray that you grant wisdom to those who are making decisions, and it would be in your will and in the best interest of the people of Oklahoma County. Father, just help us to always look to you and to see through your eyes and to sense with your heart, Father, things that we need to make decisions on. We praise you. Thank you for your many blessings and even for the challenges that we'll see today and in the future. Again, just help us to combat those in your strength according to the gifts that you've given us. We love you, praise you, and ask this in Jesus' name. Amen. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you.
You're welcome.
Are you guys needing a microphone up here since our microphones aren't working?
We're just using it.
Okay, I just wanted to offer that courtesy. All right, District 3.
Okay, I'll try to project since we don't have our mics here. But this is for consideration to rescind our current mask policy. I think it's time that this is done. I am proud of the fact that Oklahoma County never shut down any businesses in the area we have jurisdiction over in the unincorporated parts of the county. I'm proud that we did not impose a mask mandate out there. And the courthouse, it's a little bit of a different situation. But at this point, with the vaccine widely available, I have spoken with a number of people on staff and other elected officials and very strong support generally for rescinding the policy. Now, that being said, I do think it's still important to socially distance. I think masks are certainly welcome for those who still wish to wear them, but I think that it may be time to do that. And I would ask, we have our emergency management director, David Barnes, and I'd like to ask if he has any comments about this.
Good morning, Commissioners. I'll just have comments and things. I'm in agreement. I think that there is a continuity issue in the city of Oklahoma City that certainly bears consideration. And at the same time, I'm in a camp of personal choice. I would strongly encourage anyone who, for whatever reason, typically health reasons, has a concern about wearing a mask to continue to do it. So there should be zero scrutiny for anyone who chooses to do that. And that would be pre-COVID. But continuing to wear that mask if you particularly in a comorbidity situation or if you're at high risk for whatever issue, certainly I would encourage that. I would also encourage continued social distancing, continued all the hand washing, preventive measures that were in place. Those are just good practices, regardless if there's a pandemic or if there's an illness or anything that's going on around. But I do personally go towards personal choice, and particularly if we can maintain distancing from other people, I don't believe that a mandate is necessary. I did poll all of the communities, the jurisdictions in Oklahoma County yesterday, and I received 9 responses back. 3 are still in place. 6 have been rescinded of the 9 that sent me information. And my counterpart in Oklahoma City said that it's still in effect until April 30th, but they have a council meeting on April 13th to possibly discuss early discontinuance of that. So they are considering that.
If it's all right, I have asked Bill Tubby to come speak on behalf of the City County Health Department just to give their input.
Bill?
Good to see all of you guys this morning.
Good morning.
You know, our job is to inform you so you are making informed decisions. So I did bring a small presentation today to show you what's really going on. Can you hit the first slide, please?
Give me 1 second, I'll get you the.
Okay. these are our current numbers. As you can see, our numbers actually look pretty good right now as far as what we have as far as case rate, daily case rate, positivity. Our positivity is starting to creep back up a little bit, so it's likely it'll be back above 5 this week. We have an issue with testing volume right now. Our testing volume is really low. So when it comes to daily case rate, that's rate driven. So if we don't have enough testing, that's going to impact our case rate. So it looks good now, but we're not sure if it's real or not. So just looking at that. Our hospitalizations are good. We're in the green. So I mean, if you're looking at just the current data that's out there, the data looks pretty good for Oklahoma City and Oklahoma County. We've done a really good job here, and we're doing a really good job on the vaccination. So this is our testing and positivity rate. As you can see, we have peaked up just a little bit. We're just right below 5% now. We'll just have to see what that turns into. We're actually out trying to do some community-based testing today, Thursday, and Friday, just to see if we can get more people tested, to see if this is real or not. So this is our hospitalizations. As you can see, we've been on a plateau for quite some time. It's manageable. It's higher than we would want it to be, but it is what it is. So this is the CDC map on level of community transmission for Oklahoma County, and we are still in the substantial range. So all that means is there's enough people out there running around that are positive that we're still getting community transmission. This is our sewage surveillance, which is unique to Oklahoma County. It's starting to spread throughout other counties. We actually do pick up some of the other cities or in the metro area through the Oklahoma City sewage surveillance. If you see the observed reported cases, that's the dotted line. The red line is predicted cases based on what's coming out of the testing. So what this is kind of confirming is that our testing rates are pretty low, and that the likelihood that we have more cases than are being reported is probably there. But again, we can't confirm it now because you have to have the testing to confirm it. When you see those humps back early on where it matched really well, we had a lot of testing going on in the county, so the models matched up really well. So we have to assume that the models, that it still works. We just can't confirm it with the testing. So, with that information in front of you, the only things that I would ask you to consider are we still have issues. We're having expansion, especially in all the states up on the northern border with variants. So we're starting to get some variants. Unfortunately, our state has the lowest variant testing in probably almost all of the states. So hopefully we're going to pick that up. I think the OSU lab's coming online now to be able to do variant testing.
Do we have any known variants here
We have some that, yes, we do.
in Oklahoma County?
I don't have that specifically because I have it from the nationwide database. I don't have location codes on it. But I mean, there's like 11 cases of the UK variant. There's only one of the Brazilian, and I think there's only one of the South African. So far,
We don't know if the vaccines work against those.
They do.
They do.
They do. Some of them have lower efficacy, but that also brings up another good point. We're doing a good job on vaccination rates here. We're at about 18% for people being completely vaccinated in this county. That's with both doses or with a single dose of Moderna. And we're up around, we're in the 30% right there on another with single dose. So we're doing a good job. We're not quite where we need to be to feel really confident that we need to reduce the mitigation measures at this time. So one thing that I would have you consider, since you are a public serving body, I don't know if you've even taken a look at seeing how many of your folks have been vaccinated yet. So you might want to consider that, and also consider, when you release, if you release the mask restriction for your buildings, can your facilities take an uptick in cases? Can you afford to have people out? I don't know that it will occur. I'm just saying the possibility is there. If if you have low vaccination. So that's all I would bring to you at this point.
It's my understanding that every county employee who's wanted one has been offered the opportunity to do it. Certainly in the courthouse, that is absolutely the truth because of those working court system. They were offered maybe even in phase 2. So I think we're fairly vaccinated as in our clinics. David, you might have more to share, but I think, or Dan, I think we have facilitated with a statewide network, and I've personally allowed every employee to even go do it on company time if it involved making a long drive just because of security for the other staff. So can't speak for everyone's employees, but I have checked in for several, and I think our vaccination rate here is probably extremely high, at least amongst those willing to take it.
I know it's gonna be good, I just don't know how good. I mean, we've even helped you guys with some of that.
Sure, you have.
That would be my question.
Yesterday, CDC reported that topical contact is not where they're thinking most of this is contracted from. Do you concur with that?
I do.
We've spent a lot of money on wiping down our surfaces here, I think to the tune of about $600,000 a year is the projected cost for that. But that's not probably mitigating COVID. It might be helping with the flu and the sniffles or other germs, but not for that.
Well, realize too, that's a point in time. I mean, if we get new variants that act differently, that could change as well. But right now, that appears to be the case. Correct.
Okay. All right, further questions, Mr. Maytubby?
So our current policy, we don't have an end date, do we?
I think
I don't think so. I don't think there's an end date on it now, and so not that I'm aware.
Okay. It would be my preference that we extended it through April 30th and maybe consider ending it on April 30th to give the numbers a little more time so that we know the numbers are going down and hospital rates are staying the same. That's what I would be comfortable with, is through April 30th.
Well, I think we need to go ahead and do away with it now, so I'll move that.
Okay. I'll second. Any other discussion? All in favor, say aye.
Aye.
Aye. And opposed?
No.
Okay.
Thank you.
Thank you, Bill.
Thank you
You're
both
welcome.
for your time.
Call me anytime.
Thank you.
Engineering.
Item number 3, this is a contract with Pinnacle Consulting Management to do some right-of-way work for us out in District 2, Fair Road, 36th Street. To refresh your memory, we get a federal VR allocation every year. It's about $450,000 for our bridges, and it's a use it or lose it by May 31st. We actually did not have any project ready because they all got hung up in environmental. I put an email in front of you from ODOT where they're giving us permission to buy it, what they call at risk because the environmental's not complete. Commissioner Bloomer helped me with that quite a bit to talk ODOT into that. So we've got a very short window from now to May 31st to get this right away cleared. And it depends on if we got willing sellers or not. If we got a chance of making it and securing this money, and if we don't get a willing seller, then we won't get it done, and the money will go to some other county. But I want to give it every effort.
It's been part of our battle this whole project, so I appreciate your cooperation with this, and I'll move this item.
Second.
All in favor, say aye.
Aye.
Opposed?
Cassie, I think my screen is frozen. You really just become our teachers.
Item 4 and 5 are change orders for our plumbing contract in this building. Keith, would you like to talk about these?
First change order deals with flooring and the way the transition is made from the poured-in-place epoxy floor up the wall in each of the bathrooms. Originally, a plastic code base was to be used, creating a grout line or a joint between the poured floor and the code base. That joint could harbor bacteria. The cleaning crew, when they come in, they'll mop and slosh around, use the floor drain. This, of the 20 bathrooms, the cost is right at $1,000 per bathroom to turn the epoxy floor up the wall approximately 4 inches so that we have a contiguous surface and eliminate that grout line.
Probably ought to do that in my own. Okay, is there a motion?
I'll move approval.
Second.
All in favor, say aye.
Aye.
That was 5 also, right?
No, the next change order is actually a credit to us. The way the bathroom walls are constructed, rods are used for the vertical support. There is a lath, a plaster, and then a tiled surface. There isn't any framing there particularly to speak about. What was being proposed was removal, or proposed here, is removal of the tile, leaving the rods, leaving the mortar foundation or base, and using a skim coat to smooth the texture and then apply an epoxy paint, rather than use a drywall type product on the wall. So this one needs to happen.
So it will still be a tile wall?
No, it will be an epoxy paint
Okay.
that is impervious to liquids.
I will move approval.
Second.
All in favor, say aye.
Aye.
Commissioner comments, District 1.
I have no comment.
I just want to congratulate those who won elections last night. We have a new mayor in Hedden, Darrell Davis, and was a councilman, now the mayor. We have Stacy Peterson and Ms. Buck, both of whom also were victorious, are on the city council. And then to Senator Jake Merrick for his victory, congratulate him. And then in Oklahoma City, the 2 victors on the city council, Bradley Carter and Barbara Young. Congratulations to them, and to all others who won races elsewhere as well.
And we have a new mayor in Kara also. And then I just on, back to the other item, I want to say that I certainly understand any employee who wants to continue to wear a mask. That's certainly permissible. And any employee that has not received their vaccination that wants one, I know they should reach out to Dan or David Barnes, and they will help them find facilities if they don't have a local medical person they count on for that assistance. We certainly encourage anybody who wants to do that. I, for the record, am fine with any county employee going and doing that on county time as part of public safety. So I think that probably speaks for all of us in that, for any department head that's listening. And I think that part of the enforceability of this has become less, and because people have vaccinated, they feel like they are not needing to wear the mask. So I think this was fitting time. Thank you for doing this.
Just one other thing, we should note that judges still have the discretion to impose a mask requirement within their courtrooms. This does not impact that. So, thank you.
Okay, any citizens wishing to be heard? Is there any online? Okay, if not, is there a motion? Well, I want to also mention this special meeting was called because there was a executive session item that needed to be heard, and there was a malfunction with how it uploaded to the website. So in the abundance of transparency and consideration, the district attorney said we'll need to do that again tomorrow. So I
So we'll
apologize
see you tomorrow.
for having to do that, but it is only for hearing an executive session, so I hope it won't be too terribly long. All right, is there a motion to adjourn?
I'll move we adjourn.
Second.
All in favor, say aye.
Aye.